Clostridium difficile is a gram-positive, spore-forming anaerobic bacillus. In other words, it is a bacteria that normally lives in places lacking in oxygen, which, in the case of C. diff, is the large intestine of the human being. It has existed in the environment, and according to Dr. Pierik of Philipps University, Marburg, its enzymes are ancient. However, it was not until the 1970s that toxigenic C. diff was identified as a serious problem in human beings, following the widespread introduction of antibiotics into clinical practice. C. diff is now thought to be responsible for a spectrum of largely, but not exclusively, hospital-acquired infections, ranging from colonisation with no symptoms, to diarrhoea of varying severity, to life-threatening colitis. According to UK statistics, more people die of C. diff than do of MRSA. In June 2008, the national statistics in the UK have confirmed that more than 20 people per day die of MRSA and C. diff together. Comparative figures for Ireland are not known. A small number of people go into hospital with C. diff already present in their intestine. They may not have had any symptoms because the normal bacteria in the intestine has kept the C. diff in check. However, if the condition suffered by the patient has to be treated with antibiotics, the positive bacteria may die, causing the C. diff bacteria to multiply and cause an infection. However, many more patients become infected with C. diff while in hospital. How does this happen? Patients may ingest the C. diff bacteria through oral fecal contamination, i.e., traces of one patient's faeces enters another patient's mouth. This happens as a result of inadequate cleaning. C. diff can be picked up from tables, curtains, in fact anywhere where hands can reach, not to mention toilets and all the fittings in them. Patients should wash their hands before eating, and those who are bedridden should be helped to do so. The symptoms include diarrhoea. There may also be stomach cramps, fever, nausea, and loss of appetite. Some people get mildly ill and recover. Others become seriously ill and develop colitis. This can become severe and lead to perforation of the bowel. At this stage, the disease is life-threatening. The patients most at risk are those who have had bowel surgery, chemotherapy, prolonged hospitalisation, a history of antibiotic usage. As with most infection, those who are frail through serious illness or debilitation or increased age carry increased risk according to the HSE. Treatment involves antibiotics and extra days in hospital. The prevention strategies for C. diff are well known. These include robust hand hygiene practices in healthcare workers. This should be in place for patients as well. Environmental hygiene is also essential, and the training of cleaning personnel in infection prevention and control is of utmost importance. Antibiotic prescribing is also a matter that needs to be controlled. These strategies are not new and have been recommended by microbiologists for many years now, to very little avail. You can find out more about C. diff on the following websites, among others: www.hospitalinfection.org, www.hse.ie, www.dh.gov.uk, and www.health.gov.co.ca.